Hi everyone, welcome to my overview of assessing and improving the debriefing effectiveness of nurse educators who facilitate simulation in a pre-licensure nursing program, a pilot study. A little bit of introduction to my scholarly practice project. Many of you are familiar with simulation, especially in nursing education. And especially in light of the recent COVID pandemic, where there were a lack of clinical sites, so a lot of institutions went with simulation to train new nurses. The focus of my project is going to be on debriefing. So debriefing is a process in which students are guided by trained faculty to engage in reflective thinking of the learning experience. Now, debriefing is very important to simulation because during a simulation-based learning experience, the learning has actually been evidenced to occur primarily during the debriefing. So effective debriefing sessions are essential for nursing students to attain clinical knowledge, to help them develop that clinical judgment, and to provide training necessary for novice nurses to be able to function competently in our complex healthcare environment. Unfortunately, despite the increasing need and use of simulation, there continues to be growing evidence that nurse educators are not adequately trained and are facilitating simulation without effective debriefing. Now, this is something that I noticed at a local practice site. My problem statement is, a knowledge deficit in debriefing best practices and guidelines was noted at a local pre-licensure nursing program. This is a problem because nurse educators are tasked with teaching high-fidelity simulation at the project site without the necessary training, certification, or education to do so, without ongoing faculty development, and without knowledge of debriefing best practices and guidelines that are put out by regulatory agencies. So what I saw was that there was no consistent, effective debriefing going on. Lack of debriefing effectiveness at the project site is potentially leading to simulation-based learning experience that are lacking in quality and effective knowledge attainment for students. This project will describe the evaluation of nurse educators' self-assessed effectiveness in debriefing simulation and the significance of implementing an online education intervention on debriefing effectiveness. Now, a little bit of a background. As we discussed before, the debriefing element is a crucial step in simulation because it leads students to deeper levels of learning and improved transfer of knowledge to the clinical setting. So this has been evidenced. The literature does support that simulation alone without debriefing may result in unsuccessful learning. Preparation of simulation facilitators has been shown to be essential to a program's success. In 2016, the International Nursing Association for Clinical Simulation and Learning Standards Committee suggested criteria for educators to perform high-quality debriefing. They also proposed that facilitators receive formal education and debriefing. The National Council State Boards of Nursing stated that increased amount and consistency of faculty preparation is a necessity for simulation programs. This led to an appeal for formal training in simulation for nurse educators. The National Council State Boards of Nursing simulation guidelines were issued so that state boards of nursing can ensure that debriefing is occurring during the learning part of simulation and that faculty receive formal training. Unfortunately, this is not what has been going on. So going back to the project site, my project objectives and aims are to assess the debriefing effectiveness of nurse educators at this particular project site, then to provide knowledge and faculty development on the current debriefing standards of practice and debriefing methods. A third aim is to provide nurse educators with support as a simulation mentor. My fourth project objective is to enhance the self-assessed debriefing effectiveness of nurse educators after implementation of my educational intervention. And then my final aim is that upon completion of the project, I hope to disseminate project findings at the project site to support ongoing training and faculty development for simulation facilitators. My research question is, will the implementation of a learning module on debriefing increase the debriefing effectiveness of nurse educators who facilitate simulation in pre-licensure programs? My hypothesis is that yes, there will be a positive relationship between the implementation of a learning module on debriefing and the self-assessed debriefing effectiveness of nurse educators. My theoretical framework is something that you may be familiar with. It's the novice to expert theory by Patricia Benner. So Patricia Benner developed this theory of how a nurse starts off as a novice with no professional experience and then climbs the clinical ladder to become an expert. She based this on Dreyfus's skills acquisition model. One thing about her theory is that it is transitional and it is in context. So if you have an expert clinical nurse and they are new to the role of an educator or a simulation facilitator, then they do revert back to being a novice. So I hope with education to help nurses that are perhaps novices or beginners or maybe they feel like they're confident, develop more proficiency and to attain that level of expertise. So to advance in their professional growth as a simulation educator. The philosophical assumptions that are related to my project, I simplified the categories, and then on the demographics survey, I asked each participant to identify themselves as either a novice or competent or expert as a simulation facilitator. So a novice simulation facilitator, they identify themselves as learning but need more training and experience. If they identify themselves as competent, then they are stating that they're able to debrief competently but want to learn more. And if they identify themselves as an expert, this means that they are able to debrief simulation, mentor other nurses or other educators, and to teach others in simulation. The evidence-based model that I use as my framework was the A-STAR model of knowledge transformation. It has 5 steps, starting with discovery research, evidence summary, translation to guidelines, practice integration, and process outcome and evaluation. I actually have a model as it applies to my SPP. So step 1 is discovery, and this was discovery of the issue at the local pre-licensure program and review of the literature. Step 2 was evidence summary. Best practice guidelines were reviewed, and the most recent were developed in 2021, and I gathered them all up together, summarized it, and found an education module online that will support the transfer of this knowledge to the educator who's viewing the module. Step 3, I provided an assessment tool. This was a known tool most commonly used in the literature. It's the debrief and assessment for simulation in healthcare. I provided this tool as a survey, and I asked nurse educators to actually self-assess themselves using this tool to see how they rated themselves in terms of debriefing effectiveness. There are 6 categories or 6 elements, and each element is made up of certain behaviors. So they had to rate themselves in each element and then on each behavior. Then after they reviewed the education model, I asked them to integrate which is step 4, what they learned and what they know now in terms of methods of debriefment and clinical guidelines and standards of best practices, and integrate that into their debriefment pedagogy. So after 8 to 12 weeks of having them practice this integration of getting this new knowledge into their practice, I did step 5, which was evaluation, where I administered the DASH survey tool again. And I then compared the scores of pre-test to post-test to determine the effectiveness of the intervention. This was basically my project method. So if you see the slide, you can see how each step of the slide was in accordance of my evidence-based model, using that as a framework. The pre and post DASH scores were then quantitatively analyzed through Intellectus statistics, and that's where I'm at presently in the moment of spending hours looking at my statistical results, and hopefully we'll be done soon. So thank you for listening, and please let me know your comments, thoughts, or suggestions. I hope everyone has a wonderful night.